Here is MRI of the lumbosacral spine on 37-year-old male with history of right-sided sciatica. So what we see on this MRI is abnormality at L5S1. I have magnified this region. So what we see on the sagittal sequences is mild disc dehydration, annular fissuring, and mild diffuse disc bulge without disc protrusion. So if I go to the axial, there is no disc protrusion. The disc bulge is asymmetric and the annular fissuring is happening in the right paracentral region. On the axial, the thecal sac remains capacious and the traversing S1 nerves appear unremarkable. On the axial, we see there is some abnormality happening in the exiting right S5 nerve, right L5 nerve, so which can be better evaluated on the sagittal T1 sequence. So this is on the left side. There is good fat around the exiting left L5 nerve, but as we come more laterally, the disc is touched by the bulging disc, possibly irritating it. But more importantly, on the right side, the fat around the exiting right L5 nerve is effaced, and here we lose the fat around the nerve completely, and the nerve is slightly swollen. So this is mild to moderate impingement on the exiting right L5 nerve. I would like to re-emphasize again that impingement on the exiting nerve is best assessed on the sagittal T1 sequence, not on the axial T2 or axial T1 sequence, neither on the sagittal T2 and stir sequences. So this is a case to show impingement of the exiting nerve, which is best demonstrated on the sagittal T1 sequence.